Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Shukri bin Zainal and I am from SR2433C. So today I will talk about the injury about elbow, that is elbow hyperextension injury. So let's go. So for the first slide is talk about the anatomy of the injury. So basically the injury of elbow hyperextension is happen when your elbow joint is bent beyond the normal range of motion. This type of injury can damage the ligament and bones of your elbow. And then the common injury is your elbow is to dislocate. It's because the hit at your elbow. The most common sport that will get this injury is like rugby, football, boxing and others. Now we go to the procedure of tapping. It have 3 steps. Step 1, step 2, step 3. You can see the step, and after this I will show you the strapping video. It will show you all these 3 steps. Now we go to the do and don't when perform the strapping. Okay, we go to the do. First, make sure the skin is clean and clear. The second, ask the patient to tense the muscle before strapping. And then the don't part is don't tape at the skin that have wound because it's dangerous. And then the second is don't overwrap because it can stop the blood flow. Now the equipment part, it just have 2 equipment, that is rigid strapping and elastic adhesive bandage. Let's go, enjoy the video. Alright, now let's start. Firstly, strap at the middle of the forearm. You can see how I strap at the forearm. Make sure ask your patient to tense the muscle first before starting the strapping. And then strap at the bicep. Yes, like that. After that, do a straight line from the bicep to the forearm. Just straight line from the bicep to the forearm. Next, do the X shape, like that. X shape. Do this for 3 times. This means you have 3 layers of the X shape. This is the first layer. Then this is for the second layer. Still second layer. And this is the last layer of the X shape. After this, strap again at the forearm. Yes, like that. And at the bicep, you can see. Yes, this is for the bicep. Yeah, so done. The last step is use a elastic adhesive bandage to cover all the entire strapping, but I doesn't have that. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Faris Izani bin Saharum. Today I will show you how to treat tennis elbow injury. Okay, first the equipment we need is scissor and kinesio tape. Okay, first we need to make sure the elbow must in a 90 degree because we want to treat the injury at lateral epicondyle. Then prepare 3 strips with 2 strips 15 cm long and the last one 25 cm long. After rip the paper, apply the first piece of the tape at the humerus and put up at 80% stretch straight down the lateral epicondyle. Then use the paper and slide it on the tape to make sure the tape attach with the skin. After that, apply the second piece of the tape at the lateral epicondyle and pull out at 80% straight to the ulna. For the third strip, apply above humerus and going around the elbow with 25% stretch and lay it down the pain straight to the wrist extensor muscle. And make sure all ankle must in 0% stretch. For do and don'ts, clean the surface of injury to be taped. Don't apply the tape immediately before or after exercising or showering. Do use underwrap to prevent skin inflammation and strengthen adhesive for rigid taping. Touch the adhesive of the tape. Under the edge of kinesio taping, don't never apply to broken or frail skin.
Assalamualaikum and hello everyone. I'm Nur Sofetu Akmal binti Muhammad Fauzi from RSR 2433C. Will be present about general elbow pain. The elbow consists of three bones coming together at the junction, as well as the muscle that serve to flex, extend, and rotate to the arm. The elbow also consists of ligament that hold bone in place, tendon that attach muscle to bones, cartilage that allow movement of the bone or at their joints, and nerve that provide functionality to the arm. Each of these different parts can become irritated or strained, resulting in pain. Elbow pain can be dull, achy, and not specific to any one particular area. There may also be times when you want general support used in sport, daily activities, or outdoor work. Elbow weakness and pain can occur due to hypertension of the elbow, or use in sport or physical activity, or as a result from problem further down or up the arm. Next, do's and don'ts. For do's, first is you have to clean your skin well with alcohol, hand sanitizer, or pre-tapping cleaner to make sure when apply the tape sticky well. Number 2 is round the corners of each strip before apply to prevent the corner from lifting prematurely. Number 3 is clip or trim your hair close to skin on heavily forested area that may be pain when you want to remove the tape if you are not trimmed. For don'ts, number 1 is you apply the tape immediately after and before shower and exercise, and the tape cannot sticky in wet. Number 2 is you are apply tape to the match or irritated skin that can produce bacteria. Number 3 is you cannot touch the adhesive sides of tape. For the equipment, we just only need 2 strips of Kinesiology tape. That's all for general elbow pain from me. Thank you.
Hi, my name is Muhammad Ikhwan bin Muhammad Fauzi. I'm from SR2333C, and so I will talk about for subject SPS523 for elbow injury, which is a golfer elbow and a medial elbow pain. So first thing first, I will talk to you guys about the golfer elbow. So first, I will talk to you about the anatomy of the injury. So golfer elbow is a condition that causes pain where the tendon of your forearm muscle attack to the bony bump on the inside of your elbow, and the pain might spread into your forearm and your wrist. Alright, so for the next, you go through the common injury of the golfer elbow. Alright, so a common causes is tendinitis and inflammation or injury to the tendon that attack muscle to bone. And also the tendinitis of the elbow is a sport injury, often from playing tennis or golf. Alright, so basically the golfer elbow is for athlete to have playing tennis or golf. Alright, so you go through to the procedure of kinesiotaping. So there are 3 steps. First step, you must anchor white tape at the front wrist and apply the towel over the lower arm toward the elbow while bending the wrist backward. So the second one, anchor another white tape at the medial side of the elbow and apply the towel across the arm. And the last step is place the L tape over the medial part of the elbow with 50% stretch applied. Alright, so that's the procedure of kinesiotaping. And do and don'ts during perform the kinesiotaping is: do make sure the skin is clear and clean and around the corner of each strip before applying to prevent the corner from lifting prematurely. And for don'ts, don't tape at the skin that have wound, and also don't apply the tape immediately before or after exercising or showering. You must take the time to make sure your skin is dry to apply the kinesiotaping. And also the equipment for this kinesiotaping is, of course, kinesiology tape and also scissor to cut for the kinesiology tape. Alright, so for the next video, I will show to you guys the procedure how to do or perform a kinesiotaping.
Alright, so the first step is anchor white tape at the front wrist and apply the towels over the lower arm toward the elbow while bending the wrist backward. So for the second step, anchor another white tape at the medial side of the elbow and apply the towels across the arm. Alright, so the last step is place the last eye tape over the medial part of the elbow with 50% stretch applied.
Alright, so have you watched a procedure of a golfer elbow procedure to kinesiotaping? Alright, so now I will tell you guys about the medial elbow pain. Alright, so basically from my opinion, they are similar for golfer elbow and a medial pain, but have a little different about these two injury. So the anatomy of the medial elbow pain injury is a medial epicondylopathy or golfer elbow is mostly a tendinous overload injury leading to tendinopathy, and a flexor pronator tendon degeneration occur with repetitive forced wrist extension and forearm supination during activity involving wrist flexion and forearm pronation, flexion and pronation. Alright, so at the point at the slide, you can see the picture of a golf elbow or medial epicondylitis tear in tendon. Alright, so you go through the common injury of medial elbow pain. If you have a golf elbow, you may experience any of the following, which is a pain on the inside of your elbow, elbow stiffness, hand and wrist weakness, you feel weak and difficulty moving the elbow. If you have a golf elbow or a medial elbow pain, this is a common injury of a medial pain. Alright, so we go through to the next procedure of a kinesiology for medial elbow pain. Alright, so they are different, both golfer elbow and a medial elbow pain. And a procedure for kinesiology is, first step, you must anchor L tape at the front wrist and apply the towel at the medial side of the elbow with 50% stretch while bending the elbow slightly. And the second step, you must anchor another L tape at the medial side of the elbow, and apply the towel at the side of the wrist with slight stretch applied. So there's a procedure for kinesiology, and do and don't. I think same from the golfer elbow, which is you make sure the skin is clean and clear around the corner of strip before applying to prevent the corner from lifting prematurely, and the don't tape at the skin that have wound, and also don't apply the tape immediately before or after exercising or showering, and make sure your skin is clear and dry. Alright, so for the equipment for the medial elbow pain is same for a golfer, which is you must have a kinesiology tape and also a scissor. So for the next, I will show you guys a procedure for a medial elbow pain kinesio taping procedure. Alright, enjoy the video.
Alright, so for the medial elbow pain procedure, anchor eye tape at the front wrist and apply the towel at the medial side of the elbow with 50% stretch while bending the elbow slightly. And the second step, anchor another eye tape at the medial side of the elbow and apply the towel at the side of the wrist with slight stretch applied.
Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Fazlina binti Abdul Samad and I'm from SR243C. And today I will let you guys know about golfer elbows and its trappings. So medical epicondylitis, or we known as golfer's elbows, is a type of tendinitis that affect inside of the elbows, and it develops where the tendons in the forearms muscles to connect to the bony parts of the elbows. Tendons is the muscles that connects to the bones. Due to injury and irritations, it can become swollen and also painful. Although it known as golfer elbows, it also occur in many types of sport. They use arm and also forearm. For the example, volleyball or basketball. So to let you guys know more about this, let's go and see our models. So as you guys can see on my model, so here is where the medial epicondylitis. So I would like to show you guys how is the procedure to do strappings on golfer elbows. Let's go. For do, clean the skin well with rubbing alcohol, hand sanitizer or pre-tapping skin cleaner. Next, round the corner of each strip before applying to prevent the corners from lifting prematurely. Next, trim hair that close to the skin. Next is don'ts. Apply tapes immediately before or after exercising. Next, do not stretch the tape all the way to the end. And last, do not apply tape to any damaged or irritated skin. So that's all from me. Thank you.